All right, well, it looks like it is officially 7 o'clock, so I think we'll go ahead and get started here. I see that folks are starting to join us on the live stream. So hello and welcome to another edition of Shy Hack Night Remote. We're glad you can join us. We hope that you're taking care. We are going to start out with introductions as we normally do. Tonight, we'll be hosting. My name is Cameron. I'm a board member here at Shy Hack Night, and I'll turn it over. I guess we'll do 3-word introductions too, as we normally do here. So at Shy Hack Night, we do 3-word introductions. So Cameron, so, he, him, learning about learning.
And I'm the other co-host. I'm Katie, she, her, hers, surrounded by dogs.
Yay, dogs.
And could not be happier.
Awesome. So in a few minutes, I'll be turning it over to our featured presenter for the night, who will be introducing themselves shortly. But first, we wanted to share a few announcements. And so we'll start off with that. Our first announcement is in solidarity with the Black Lives Matter movement. For those who are interested or concerned with our response to the present moment, you can find our statement on our blog. In short, we stand in solidarity with the Black Lives Matter movement. We do not think that we can remain silent or on the sidelines, and that it's an important time to listen, reflect, and learn, but also take action. So we stand in solidarity with those seeking to fundamentally transform institutions of systematic oppression and to root out culture that is harmful to our society. So we seek to celebrate and affirm the multiplicity of perspectives, stories, and peoples essential to the weaving of a more equitable American fabric. So if you'd like to read our statement at length, please find that on our blog. We also do recognize the importance of taking action, and you can see the actions that we've committed to, along with an update on our 400th episode, which was focused around actions toward racial justice. So we hope that you do give that a look. We'll move on now to our next announcement, and I'll hand it over to Katie.
Cool. So the next one is about a group that was started by our president, Derek Eater, our Shy Hack Night president, just to be clear. And it's basically to help any groups that might need any tech or data assistance during this time. And so if you want to sign up to get assistance, you can follow the link here, and we will put that in Slack. And then also, if you want to volunteer to offer this kind of help, you can follow that other link right below it. We will also provide that link.
Okay. And so at Shy Hack Night, we're big on civic responsibility. So we want to remind you to fill out your census. Tell everyone you know to do the same. So you can find the census information at my2020census.gov. Just that you can see the response rates to date. But please do remember to fill out your census.
It's important. Let's be counted. All right. So, Nonprofit and Social Good Technology Month. If you want to get connected via some webinars, there are a variety of dates here. And as you can see, the topics include theory of change, technology planning, disaster recovery, and product demos. And you can RSVP for free at that Eventbrite link. We will also share that with you.
And for those who have been attending the recent remote Shy Hack Nights, you know, we've kind of made a few tweaks and changes along the way. So thank you for bearing with us. Your feedback has also been helpful in that process. Tonight, we're going to try a new post-presentation Zoom call. for intros, announcements, and breakout group pitches. We'll start a little bit after the presentation at 7:45. You can see the link posted, and we'll also point to the link in our Slack channel. So those are the announcements for today, but just a brief reminder of the overview for the next steps here. So in a moment, I'll be introducing our speaker for the evening. After the presentation, be sure to stick around for Q&A. As usual, we will be fielding questions from the YouTube chat. As a reminder, if you aren't already familiar with our code of conduct, please do look at that. It will be enforced, and we have done a really good job here at Shy Hack Night making sure that people have been respectful and considerate in the questions that they pose, and we'll expect the same tonight. Katie and I will be moderating as well, and look forward to the questions that you have. But we're really excited tonight to share our feature presenter, who I will turn it over to now.
Hi, thank you both. I'm really excited to have the opportunity to talk with you all tonight. This is special for me. Been at quite a few Shy Hack Nights in my past, and really the only thing keeping me from there these days are a couple of little kids. But it's great to connect virtually and see some familiar faces. So as I get started here, I'm gonna take a chance and share my screen and just see what happens. Maybe if I could just get a thumbs up if everything's sharing okay.
Yeah. We see it well.
All right, excellent. I want to talk with you tonight about COVID-19 and data and our response and racial justice. So if you just indulge me in a moment before we get to that topic, I do want to tell you a little bit about myself, because I appreciate knowing a little bit about who's talking at me for about 15 minutes. So here we go. So just a little bit about me. I spent the 1980s and 1990s in Ohio, which is where I'm from. And I spent the aughts and the tens in Chicago. And I'm still here. So I love this city. This is my home. I have, as I said, I have two small daughters, and my wife and I, we live in Logan Square. And so we've spent quite a few years building our community and getting to know our neighbors and setting up our family. And so just a little bit about my professional background. If I didn't have to make money, I'd probably be playing guitar in a band. So this is really my natural habitat. But unfortunately, I have never figured out how to make enough money to put a roof over my head or feed myself doing that. So I had to figure something else out. So for reasons that I still haven't quite figured out, I decided to become a lawyer. So I spent about 8 years doing public interest work. For the city of Chicago, I did environmental code enforcement, and quite a few other public types of litigation. And after that, I went on to work for the state of Illinois, and I was a chief administrative law judge of at Human Services, the Department of Human Services, where I oversaw medical, Medicaid, and all sorts of public benefit program appeals for eligibility. And after working for the state, I came back to the city, and I worked in the transportation department, overseeing public safety inspections and public way. And then not too long after that, I found Shy Hack Night. And as I said earlier, it was a really special find for me, because after the first time I walked into Shy Hack Night, I had a whole new network of people, an entire new perspective on what could be done with technology and data and government. And really the rest of my career was set in motion on that night. So not too long after that, I joined the city's Department of Innovation and Technology as a data scientist. And I worked on a lot of different projects across the city to try to help things work better. I also, as I was working at the city, I also joined Uptake for a data fellowship, which was really impactful and powerful experience, where I got to really just sit aside some giants in data science and learn a lot of great techniques. And then finally, earlier this year, I was appointed by Mayor Lightfoot as the Chief Data Officer for the City of Chicago. And now in this role, I work on a lot of data strategy and data policy across the city. But given that I started earlier this year, quite a bit of the work that I've done has been related to COVID. And so I'll be talking with you about that shortly. But before I get started, I just wanted to say a few things about Chi-Hack Night in general. I think that community organizations like Chi-Hack Night are just features of open government. And they empower residents to connect directly with a small and limited government staff, which is always going to be small and limited. But when those two interact with each other, it becomes a force multiplier. And right now, we need in government to listen to you and to know what we need to do better. And so I come here tonight to listen. I want to learn how to design government to give communities the information and thereby the power that they need to enable change. And so later tonight, I will host a breakout session. And the purpose of that is to listen. So as Chief Data Officer, I want to know, what can I do to empower us to fix broken, unjust institutions and deliver racial justice? But before we get to that, I'll transition over to talking about COVID. And this is going to be a story, and it's in chronological order. So I'm going to walk through our experience, or at least my experience, working in this job of COVID and what happened, especially from a racial equity point of view. And so when it all started, the goal was flatten the curve. In the aggregate, we were talking about aggregate numbers, and you all might remember this. You may have seen this. You may have seen it 10 times, 100 times, 1,000 times. I'll walk through it very quickly. When COVID first hit, there was a big concern that if it spread quickly enough, there was going to be more people who needed healthcare than the system could care for. And so it was going to burst through the system capacity. And the goal at the time was to flatten out the curve, meaning make the spread happen less quickly, so that although you couldn't stop the fact that people were going to get COVID-19, make it so that the healthcare system is never at full capacity and can handle the need. So that begs the question of, how did we determine the curve? The city of Chicago, through its public health department, does not naturally know all the testing that's done. Testing is done by private companies. And so your Walgreens, hospitals, outpatient care, doctor's offices. And so if you think about it, you get sick and you have symptoms and you go see a healthcare provider. And at some point, there's going to be a referral for a test. And the city naturally doesn't have all the information on all those tests. And so to fix that gap, companies have to send their lab reports to the public health department. And then the public health department can take that information and build an epidemiological curve and start to understand how we're doing. And so back at the beginning of COVID, the testing shortage was so severe that that the public health department also had to look at lagging indicators, things like deaths and symptom surveillance of what symptoms are people reporting to emergency departments with, which can give you can do an inference to determine how much COVID-19 is out there from those indicators, since you weren't able to get it from all the tests. And what we're going to look at here is, this is a very early version of some of the data as the curve was just beginning to be compiled. Now, from the beginning, this data that's collected from testing centers and brought to the city was put on the public website. And in fact, the entire story that I'm going to tell tonight is available from public information. And so this is an early version. You can see that each date has a number of people tested positive. And here back in March 28th, it's only going one direction, and that's up. And additionally, to complement that report, there was also this symptom surveillance chart, which the point here is to use 2019 as a baseline of all the times that people were reporting flu-like symptoms, COVID-like symptoms, and then compare it to 2020 with the public health being aware of, in general, how many viruses are out there at any given time. They can use this to determine the likely amount that actually comes from COVID. So this was a way to supplement the curve back before we had good rigorous testing. And so again, we're talking about data in the aggregate at this point. And none of this tells you what's happening within different groups in the city. So it doesn't break it down by race, it doesn't break it down by ethnicity, and citywide numbers don't tell the whole story. So what happens when we look at COVID-19 data with an equity lens? And what happens is that we, very early on, racial and geographic disparities were discovered in the data. And that immediately led to a conversation about the concerns and why is this happening? Now, this unfortunately is a very, very short dive into some of these issues. And of course, historical structural inequities and disinvestment. There was also at the time false rumors that were spreading, things like the Black population cannot get COVID-19. Anecdotal reports that people were believing that you had to travel long distances in order to get COVID, or only the affluent were going to get COVID. And then adding to this, the fact that essential workers tend to skew towards racial minorities all led to concerns early on that the disparities in the data were telling a really, really difficult, disparaging story. And so we're looking at the data as of April 5th, and this is when the alarm bells went off. You take a look at the different case rates. These are adjusted for population. And it's just so stark when you look at the Black population bar. You see that it's more than 2 times the case rate of any of the other races. And so once this data was found, or it was discovered, it was all put on the public website. And so following that, there was an awareness campaign. The racial disparity data is released. It's put on the website. There's press conferences, public awareness. The mayor is talking with community leaders to let everybody know, to try to inform of the severity of this. And the data was released on April 5th. And we started to see the curve in the Black population peak around April 24th. And thankfully, it's been on a downward trend ever since. Now, at the same time, I'm going to go back, actually, if you take a look at this chart, the LATINX bar is very low. And that led to a lot of concerns early on, because even though it was low, lots of people were voicing concerns about underreporting, also similar false rumors, and also a lack of testing sites in Latinx communities. And so there was a lot of inspection of this data from the beginning. Now, we're going to take a slight detour in the story to talk about something else that happened right at that time, which is that we're starting to see demographic gaps in the testing data that we were collecting. And speculation is going to drive this, but when the scale of the testing was just so far surpassing any kind of capacity that had happened in the past, we started to see those fields not be filled in. And the speculation is that the people who were collecting test records just had so much to do at a pace that they had never had to do before, that one of the things that stopped happening was the asking the question and filling in the box. And that what that led was that we started to not know who was getting COVID at the same rate that we were in the past. So what the city did in response to that is in April, the Public Health Commissioner, Dr. Arwady, issued 2 public health orders. And one of those orders, Order 2020-6, this order said to every testing facility that gives out a test, you've got to have a website that has machine readable text so that Google and the city and anyone doing any scraping can pick it up based on consensus standards and know what kind of testing is given out. And so, number one, this puts testing access better in the hands of people, because upon Google searches, then those testing facilities are going to be in Google's COVID results because of the machine readable text that's in the right format. But secondly, in order for the city's data to be accurate, the city has to be aware of who's doing all the tests, because remember, it's not the city doing the tests, it's the private companies. And so the city first has to be aware before it can collect that data. And so this fulfills that by making sure that all of the entities doing tests are up on the internet. Secondly, the other public order said that every testing facility needed to provide the city with a race and ethnicity and other demographics for all of the testing services that they're providing. And so this fills that gap by saying that you've got to give us your test results, but you have to make sure that field's filled in. And so I highlight the public order just to really show this is written in law. Shall provide race and ethnicity to make sure that we can have this information. And this is so important because without knowing the effect that COVID-19 is having on different populations, there's no way that measures can be taken in order to do something about it. So you've got to know about it first, and that's why this order is so important. Now back to the story. So LATINX case rates start to rise, and what we see is that subsequent to the spike in the Black population, and then after the public orders are entered requiring the data to be reported, we start to see an even higher rate of COVID-19 in the Latinx community than any other race and ethnicity. And so to bring this chart back up, this is as of just a couple of days ago. The case rate, again, adjusted for population, for the Latinx community is now over 4 times the case rate of the white community or the Asian community. And it's quite a bit higher than the Black community. And so when this data came to be, now first of all, it's already on the public website, and as it's growing, it's there on the website and the data portal, but that's not enough. So again, the mayor held press conference and warned the public and warned the leaders in the community that this was happening, and highlighted the data disparity to make sure that that conversation could happen, and so that measures could be taken. And so the press conference happened on May 6th to highlight the data and make everyone aware. And what we ended up seeing once the data was later tabulated and collected from test results was that curve, or that peak ended up happening right around that time, and thankfully has been on a downward trend ever since. And so I now bring up the curves just to kind of walk through. These lines are kind of small, so hopefully you can see that, and I'll use my mouse if you can see that. This purple line is the Black population rate for COVID. And it peaks earlier and then goes down. But the blue line is the Latinx curve, and you can see it peaks much, much later. And then you can see all the other races. And I think what this really presents is that COVID-19 hit different communities in different ways, and it hit different ethnic groups and races in different ways. And it was just so vitally important to collect that data and to make sure that those fields were provided, and then to analyze the data by race and put it out in the public and make the public aware. And so final thoughts here. I think that this was it was a huge reminder for me of the importance of public and open data. Open data has been around for quite a while now, but just fundamentally, nuts and bolts public open data remains of vital importance, because it is the city that acts as the clearinghouse in so many different venues especially public health data, the clearinghouse for all these private companies. No individual private company has the entire answer. They only have a piece of the puzzle. And the city can put it all together in a clearinghouse, but then it's absolutely important to then take all that and make it public so that measures can be taken. Another lesson was a reminder to be vigilant in requiring the reporting of these fields. Do the analysis with a racial equity and justice perspective. If this analysis was just done from a citywide perspective, we would see trends that masked over the differences that were happening in different races and different ethnic groups. Also, publish that analysis and push public awareness. It is not enough to place the data on a data portal or website and then just update it. And so it was really, really important to do that work and then push it. Awareness gives the public the best info that we have, and it empowers people to take measures. When those measures are taken and we see a flattening of the curve, that's the experience that we had. And when we believe that it was just so important to put that data out there. And so one more thing before I close and we go to questions. I want to talk about jobs. We have a job opportunity available right now on our public website. And folks, this one is so important. The police department is hiring a data analytics assistant director. And so if you want to see change in the police department and you like data, I can't think of a more impactful position that's available. Also, the Department of Public Health, the mayor just announced today that she's seeking to appropriate funds from the CARES Act, over $1 billion. And that money is going to go to a lot of different public health activities. And one of the main things that the public health department is doing is modernizing data and technology. And so with that, expect data and technology jobs from the public health department. Keep your eyes open. You'll hear from me on that, but make sure you keep your eyes open for those jobs. You can always find jobs at chicago.gov/jobs. You got to click through a couple of fields to find it. We'll also post a link in the Slack later for that. So with that, I thank you for the time. Really appreciate the chance to talk with you all and tell this story. And love to answer questions if you have any.
All right. Thank you, Nick. So as you mentioned, we'll now open it up to questions. For those of you who are in our YouTube chat, please feel free to submit questions. I'll be checking the chat as we go, but I'll start out with a question as I'm waiting for folks to submit questions. Nick, I really appreciated the point about speaking to the data publicly. I recall early on watching Mayor Lightfoot on national outlets talking about this issue before other cities had, I think, caught on to this. So I do appreciate that importance. I also wanted to point out another thing about, towards the end, you mentioned public health. I wanted to acknowledge the E. coli study, which is something that was a really important Chi-Hacknight project. To those who are in the channel, we'll also send that information out. You ended with pointing to the job in the police department. I'm wondering what role you think open data plays with regards to police accountability.
Well, I think it's fundamental, right? When I see movements for people that want change from their government, I always think back to that. The most important thing that people can have is information about their government. If we want to change the way things are happening, and I agree that we should, then we need to know what's happening. We need to know where money's going. We need to know what kind of data that we are producing related to the activities of our departments. And so open data is historically the strongest way to get data on a regular basis out to people in a way that's also automated and continually updated, so that you don't need to do additional requests in order to get the latest data as it comes in. And so I think that's vitally important. One of the things I want to walk away from tonight with is ideas for open data that we don't have out there yet.
Cool. And just thank you, Nick. For those who are sticking around afterwards, we'll send the information to join that breakout group that Nick is referencing through our Slack channel as well. We're starting to get questions through the chat. The first question is there a chart to show COVID-19 cases by age group within each race category?
Age group within each race category. I think that there is, and so we have a number of data sets on our data portal. And so if you go to data.chicago.gov, there will be a banner right at the top for COVID data, and you click on that. I believe we have broken down and combined those, but if we haven't, then I'll take that back and see if we can get that up.
Awesome. Thank you, Nick. The next question is, were there challenges with compliance for testing sites publishing their data publicly? Were there specific data guidelines given beyond the executive order?
Yeah, there's always challenges. So in the testing industry really sprang up, and in like any industry that is springing up quickly, much less in a crisis, you can't be perfectly comprehensive about the way that you create a brand new business from scratch when you're serving in a burgeoning population like that. So yes, there's difficulty, and that's why that one of those public health orders was so important, just to say that that's got to be up there and machine readable, so that then we have a measuring stick that we can use to even determine compliance. So it's an ongoing process. It's not perfect, and we're continually refining it. And was there a second part of that question? I think I missed.
Were there specific data guidelines given beyond the executive order, was the second part.
Oh, I don't think that there's any official guidelines outside the executive order.
Okay, the next question is, how, if at all, does the COVID data inform future allocation of public health funds? Will there be more investment in Black and Latinx communities from the city?
So yes and yes. So the data itself, how is it going to inform funding? The public health itself is, I think today's announcement from the mayor shows how much more money is going to be dedicated to public health. And I think that what that data showed is that as a society, we really were not ready for the type of disease surveillance system that we needed in order to respond to COVID. And so what we've got to do is we have to invest in our public health systems. We have to invest in their data and technology capacity, and the data points directly to that. So you're going to see an increase in that. And in Black and Latino communities, the mayor's Invest Southwest initiative pledges to invest $750 million in the Southwest sides in areas that haven't in the past seen that kind of investment. And so yes is the answer.
All right, thank you, Nick. The next question is, in your role, are you playing more of a data advocate role or a data gathering role? Just curious about your interface with the mayor's office. Example, COVID data, did you have to bring attention to it?
Yeah, so I actually do a lot of both. And what I think my strategy is that I use advocacy as a way to make it so that I don't have to work on the collection as much. And so I came in here with visions before COVID of creating a community within government, much like the Chi-Hacknight community, where people can come and feel part of something really great happening and share all the cool tools and analysis that they're doing. and really just embrace everybody who's doing this kind of work already in the city. You know, that's the advocacy role of bringing people together and then letting everybody in government leadership know we've got an awesome team of people doing this kind of work already, and we just don't have a face or a name to it yet. And we need to do that in order to mobilize ourselves. And that in and of itself creates data collection dividends, because the more empowered people are, the more tools that they have at their disposal, the more they are going to be collecting vital data and saving it in ways that I could never imagine or plan out myself. So like with COVID, for an example, you know, I think that my role was helping embrace automation and data pipelines and latest tools and cloud architecture. The Department of Public Health has a fantastic team and they've got epidemiologists who are well versed in data analysis. And so, you know, they really run the show when it comes to that. So we just kind of brought together our different skill sets, and it was a really great combination.
Right. The next question is there any work being done on using data in the data portal to target interventions? We know most transmission occurs indoors, so finding parts of the city with high household density.
Oh, that's a really interesting one. So I don't know. There could be, and so we have a couple of different departments I think would be involved in that, like our business affairs and consumer protection departments, buildings, housing, and public health together. And so that's a great suggestion. I'm going to take that one back and talk with my departments and see if we're doing that.
Awesome. So the next question is, I'd love to hear any advice about your process for data automation and preparation for public posting.
So thanks for asking. When I sat down with public health and we talked about how to do this, I learned from the very beginning that due to the nature of, one, the messiness of the data, and two, just the very nature of epidemiology and public health, that it was unrealistic to expect that there was going to be a fully automated data pipeline where the data comes from the testing centers and makes it to the city and gets processed and shot up on the data portal. It was an unreasonable ask once I sat down and really understood what epidemiologists do. So with that understanding, then we worked together to find out what was the next best thing. And what we ended up building is a system that is automated up to a point, but there's a critical allowance for epidemiologists to do some work each day to make sure everything's good and to do any cleaning of any bad data that shows up and do some tests. And then they can push it to being in the automated pipeline. So we kind of have two automated pipelines that have this moment where everything stops and somebody does some manipulation and then drops it off somewhere.
All right, thank you. So our next question is regarding nursing homes. So folks who pass away from COVID in nursing homes now make up more than half of the lives lost. And people of color are disproportionately affected. Are there racial disparities in nursing home deaths?
That's a good question. So I haven't taken a look at that, like slicing the data up that way. And I think the reason is because when it comes to racial minorities and when it comes to nursing homes, both of those groups in and of themselves are where all the attention is, or most of the attention is being given as part of the response. And so I think it's a good question as to whether within a nursing home, whether there's a further delineation by race, but I imagine that when a nursing home or all the nursing homes when they're getting full testing and they're getting investigation, regardless, because they're just so already so at risk. But I mean, it's a good question, and it's something I'm going to go back and take a look at.
Okay, so the next question is, can you talk about any non-Chicago Department of Public Health, non-COVID projects you are working on that have potential policy impact?
Yeah, so we have an open data order from 2012. And it's an executive order that the mayor at the time issued, creating the open data program. And one of the outputs of Mayor Lightfoot's transition committee was a suggestion to provide some reforms in it and really strengthen it. And so I'm taking a very close look at that order and the policies behind it, and really trying to see what are the changes that we can make, what are other cities doing, what are the changes that we can make to revitalize and really take up a notch on open data and how we're doing it in Chicago. I'd love to see just hundreds and hundreds of more data sets, new departments participating that haven't been participating a lot in the past, and really provide a framework and a well-oiled machine around getting data from those departments and getting out to the public. Input or thoughts on how we can do that better.
Awesome. So for those who are seeking to join the breakout group, that'd be a good opportunity. Nick, I think we'll go for another 5 minutes if that sounds good, and then
yeah.
Okay. I wanted kind of as an aside, did you have any thoughts you wanted to share on the grocery store map?
Yeah, so over the recent days, there's actually been a lot of people talking about this issue. You know, the issue that not all the grocery stores are open, some are still closed, and if let's say you're on a bus and you're trying to get groceries for your family and you go to one and it's closed, and then you got to figure out how to go to another and where is the other one, and that could just add so much time and frustration. And God forbid that you can't find a grocery store that's open. And so due to this, there's been a lot of people saying, how do we put together a grocery store directory with open status? And it was really hard because there's no single place to go. Grocery store, it's not on the websites. You call and you get recordings that were recorded months ago that are totally outdated. You literally have to visit some of these places in order to understand whether they're open. And so there were a lot of efforts on Twitter just to put together Google Sheets. And a team out of our emergency operations center here in the city, they just put their hands up in the air and said, there's only one way to do this, is you got to go out there. You got to go to the stores. You got to call as many as you can. Email if you have email, go and visit. And there's a team of people that have been doing that and putting that list together and updating it every day. And it's the best source I think we've got for our grocery stores open or not. And so once we got that list, threw it on the data portal, created a map, put it out there, and we'll continue to update it so that people can see where they're open or not.
All right. Next question. Curious about case rates by Chicago neighborhood and what those lines/peaks have looked like to help explore certain inequalities by neighborhood.
So we have a dashboard by zip code on our data portal now, and so I'll post that in the Slack after we're done. It's on one of our COVID data sets on. I think it's on the weekly COVID cases data set. So if you click on that, you should see a dashboard. And you'll be able to investigate the different, I think zip codes is how it's arranged right now. You can look at the different zip codes and see all the different curves for each zip code. But stay tuned. We're still working on dashboards and data sets. We're not done. And so stay tuned for more to come on that.
Thanks, Nick. I missed a part of that question, which the EG to that was fewer opportunities for remote jobs, traveling further to get food, etc. I'm going to ask the next question here, which is, did the missing demographic data get lumped into the other category? And if so, was there any effort to estimate the composition of the missing data to better capture the initial cases?
So that's a great question. In the slides that I was showing, the other category is the other races that are actually tagged, that where we know who they are. And we did categorize the unknowns as a different field unknown, but they're not in the visuals that I show because the visuals are all adjusted for population. And so we weren't able to adjust the unknown for population because you don't know the population of the unknown. Was there you said there was a second part about making an attempt to infer, maybe? Is that what the question was?
Give me 1 second here. Was there any effort to estimate the composition of the missing data to better capture the initial cases?
Yeah, so there was an effort to take a look at it's just hard without the information. So we looked at what the curve looked like, and really what it ends up looking like is an average across all races. And so in one sense you might think, oh, it looks like maybe the unknowns are not biased in any way, it's totally random. But then if you go back and look at that curve that I put up, because of the high incidence in the Latinx community, the Latinx curve ends up actually dominating the citywide total a little bit because it's so much of it. So you can't really tell whether the underreporting is Latinx or really everybody, because the curves kind of look similar. So it's unfortunately it's a tough call, which is why our answer was just let's require it. Let's put an order out there and let's make sure we can get that information.
We'll do about 3 more questions here, and then close. Is there city data around unemployment across race and ethnicity since COVID data aggregation?
No, I don't think we have that in the city. It's Illinois Department of Employment Security is going to have that data. Whether or not they have that on their data portal, I don't know. But I'm going to go check. And one of the great things about this job is that the chief data officers in the region here, we all stay in touch, and so I'll be able to reach out and take a look. But that's a really important metric. So we'll take a look.
Okay. Is the city also looking at COVID-19 recovery rates through an equity perspective?
Yeah, so there is a entire team dedicated to the economic recovery, a task force. And so they're looking at exactly that. They're dispatched to the neighborhoods that were hardest hit on the south and west sides, and dedicated to making sure that we see a recovery and revitalization, and that those neighborhoods are invested in ways that make sure that they not only recover but thrive.
Okay, we have a question about contact tracing. Are there plans to extract or implement the tool set into contact tracing programming?
Yes, so I want to separate out contact tracing from exposure notification. So when I'm talking about contact tracing here today, I'm talking about traditional manual public health department, bread and butter. This is what they do. This is what they've done with HIV. This is what they've done with lots of other diseases. You find a positive case, you call the person on the phone or you visit them, you ask them questions, you put an inventory together, you put their contacts together, and then you investigate those contacts in the same way. And so that kind of work-intensive contact tracing is what we're going to do. There's an RFP out for a workforce of a few hundred folks to do that work, to actually hire out of the parts of the city that are hardest hit by COVID. And I think it's paying $20 an hour to those folks that are going to do that job, and then outfit them with just great tracking technology to help them make their calls and do their visits and do the work that they do. That's what we have in plans for contact tracing.
Okay. Nick, I know I said 3 more questions. We have 3 more before we're done with the list. Do you have a few more in you?
Yeah, I'm happy to answer them.
Okay, awesome. So for folks who are standing by for the next steps in the Shy Hack Night agenda, we'll ask these 3 and then we'll move on. So is the executive order enforceable? Is there a trade-off between increasing lab throughput and getting demographic data?
So yes, it's enforceable. The public health commissioner used powers vested in her by law, and trade-off in getting throughput through the race and gender data. I think that what we're asking here is have a form and ask the person a few questions and then type it into a computer. I do think that it was probably the how hard we got hit that made that go away, but I don't think we're asking a lot, and I don't think it hurts the throughput. Testing is ever expanding. There's more testing that it's constantly increasing, so I think we can do both.
Okay. How important is it for the city to make sure they provide tools for non-data scientists to parse the available data versus just providing the open data itself?
This is a passion for me. I came into this thinking, how do we do that? We've got a successful open data portal. We've got a lot of great projects around doing data analysis to solve these problems, and I want to ask, how do we take this information and put it in the hands of regular people? I'm a regular person myself. I need the information to be readily accessible to me so that I can understand it. And I'm not going to be able to do a lot with all of these different data sets that you have to grab a tool, a statistical tool, and do work to figure out. So I'm actually asking myself that question, and that's going to be what I plan to work on in the coming months and coming years.
Cool. So we'll encourage anyone who has any ideas in that regards to join your breakout group here. Here's the last question. What is your software/data team like? Do you have a diverse team?
Yes. So the team is fantastic and the team is diverse. I don't have my statistics in front of me right now, but I can tell you that it's well-rounded and well-represented by races and ethnicities and cultures, and that everybody comes from a different background and brings quite a unique perspective to the work that they're doing. I really appreciate all of them. I sat next to them as colleagues at Department of Innovation and Technology before I came over to the mayor's office in this role, but I still talk with them every day, and then they are the ones that are doing the work here, this great work. So I'm lucky to have them. They're fantastic.
All right, Nick, thank you so much. We've covered a lot of ground. We really appreciate you taking the time, particularly in a very, very busy time for the Chief Data Officer. So thank you very much. We'll send the information for your breakout, for those who want to join your breakout group through the Slack channel. So please do stick around for that. And then Katie, I believe we have for those who will not be joining that breakout group, you can join the Zoom call that we had posted at the beginning. We'll send that through the channel as well. But Katie, am I missing anything? Sometimes I forget things, so I'm gonna look to you and to see if I've forgotten anything.
No, I don't think so. I think that's about it.
Okay. Well, I know, Nick, that there's virtual applause in the YouTube channel. We'll say thank you to everyone for attending as well. If you want to participate in any of the items that I just mentioned, please find us on Slack. But for now, we'll just say you can go forth
and hack.
All right. Thanks, everyone. Take care.
Thank you.